Welcome, ladies and gentlemen. Today, Georgia Robertson, Neve Moore, and myself, Cole Garrett, will be giving a short presentation about the condition of gastroenteritis. In our presentation, we will be covering the causes of gastro, as covered by myself. Georgia will be covering the symptoms and treatments. And finally, Neve will be covering the evidence-based approach a parent or caregiver should take when approaching the treatment of gastroenteritis. Let's begin. Firstly, let me introduce you to the condition. Gastroenteritis, commonly referred to as gastro, occurs when the stomach and/or intestines become inflamed, and usually due to an infection by viruses, bacteria, or parasites. This condition affects people of all ages, from children to the elderly. In high-income countries, it is not considered a threatening condition, but can become a major health issue in the lower-income countries who do not have proper resources to treat the condition. Acute gastroenteritis is the most common form of the disease, and symptoms usually last for 1 to 14 days. However, it can also be classified as persistent, lasting 14 to 30 days, or chronic, lasting more than 30 days. Gastro is the result of infections by viral, bacterial, or parasitic pathogens, and these are most commonly spread by direct contact, contaminated food or water, and poor hygiene is a major contributor to this. The illustration by Cassio Lim shows that touching contaminated objects such as door handles or toilet flushes can lead to the transmission of the disease. Viral infections account for most cases of gastro. However, bacterial and parasitic infections are still quite common. The use of many antibiotics over a long time can increase the risk of gastro, particularly in a hospital setting where pathogens are prevalent. People with compromised immune systems or are of older age are more susceptible to infections, as they do not have the normal flora in their gut to prevent infection. C. difficile is the most common bacteria to cause this antibiotic-associated gastro. Antibiotic-associated gastro can lead to chronic gastro if antibiotics are continued to be taken.
Gastroenteritis can be classified as acute or chronic, and its level of severity can also vary quite substantially. This accounts for the multitude of symptoms that can be present. However, the most commonly occurring ones include nausea, vomiting, and diarrhea. As the disease progresses and the severity increases, respiratory symptoms begin to appear, including a sore throat, a runny nose, coughing, and sneezing. Other signs are abdominal pains, muscle aches, loose and discolored stool, and a fever. In most cases, these symptoms will appear within 24 hours of being infected, and in acute cases, they will be resolved within 24 to 48 hours, depending on the severity. The duration of the symptoms in chronic cases, which include any case of gastroenteritis lasting over 2 weeks, can't be stated, as it varies greatly and is different for each person. The treatment of gastroenteritis depends on the severity of the client's symptoms. In most cases, dehydration is one of the main concerns because of the vomiting and diarrhea. This can be treated with oral rehydration therapy, ORT, which involves drinking water that contains sugar and salt. However, this does not always work, as clients' vomiting can continue. In this case, intravenous rehydration therapy, IRT, is used. This just means the liquid is given through a drip into a vein instead. Probiotics are another treatment option. They are used to treat diarrhea. On top of this, anti-motility and anti-secretory agents can be used if the health professional deems them necessary.
An evidence-based approach that a parent or caregiver should take when approaching the treatment of gastroenteritis is acknowledging the signs and symptoms, which includes vomiting, dehydration, and diarrhea. Start rehydration right away before the signs and symptoms get worse, because finding a diagnosis is not necessarily important to recover. But if obvious signs of gastroenteritis show, then start giving the patient fluids to rehydrate themselves, and if not too nauseous, start feeding the patient solid foods. If fluids used to rehydrate the patient doesn't work, then the patient will need medical attention and need to be put onto medication only for severe cases, which can result in death and morbidity. Ondansetron therapy, commonly known as Zofran, is a tablet that the caregiver can get over the counter, especially for children, because it reduces the risk of constant vomiting, being on a fluid drip, and decreasing getting admitted into hospital with vomiting due to the gastroenteritis.
Thank you for viewing our presentation. I hope you have a better understanding of gastroenteritis, how to identify it, and how to treat it. Thank you.